Okay, everybody, we're back to do limb length, and we're going to do lower extremity this time. Our measurement should be within 2 centimeters of each other. So while you're practicing, again, we'll recheck it and make sure we're within to be confident. So the first one on your list is called a real or true leg length, and our landmarks are the ASIS to the distal medial malleolus. Before I start, I always want to check my patient's posture because I want to make sure we're about 4 to 8 inches apart with his lower extremities, and making sure that they're not turned out in a neutral hip so that we can have an accurate measure. So he's in a good alignment. I have the limb I'm not measuring in slight flexion, and he can relax just for his low back to be comfortable. But the measurement I'm going to take, the side on the left here, is the one that I need straight. So make sure you don't put any pillow or anything under the knee having flexion in it, because you want as long and straight as you possibly can. So the first one here, okay, I'm palpating the ASIS. Now the ASIS can be very large, so the method that you do to find it, now if you are coming up to catch the most distal part, okay, I would start in the hip flexor soft tissue area, and then as soon as you hit that bony prominence, you're on the distal ASIS. If now somebody came before you and used the ASIS and didn't say distal, but they said the more proximal, you'd have to go a little bit higher and palpate the proximal ASIS. So sometimes that could be 2 centimeters alone. So we really want to be precise about exactly the landmark or the piece of landmark that we use. So I generally like to use the distal because I like to just palpate distal to proximal, and as soon as I hit bone, I know I'm on it. Okay? So I'm going to put my 0 point here. I'm not going to disrobe my patient. I can feel through. So I'm not going to mark this one. But I have my 0 point. I'm using centimeters, so make sure you're on the red side. And I'm going all the way to the distal tip, or distal segment of the medial malleolus. Can you see that? Okay. And so not the apex. Everybody likes to use the apex, or the first time you hit your hand into, you're palpating and you hit that bony prominence. It's not. You want to go till it drops off. And that would be 85. So my measure would be 85 centimeters, okay? And again, this is real or true leg length, okay? Another entire leg length that you can take on your sheet, the second one, is called the apparent or functional leg length. So this measures if there is a leg length discrepancy due to a pelvic obliquity. So as I was saying before, tends to act on the lumbar spine and posture. So this is taking into account the pelvis. So if we have any tilting happening, we would use, or suspect to, we would use this one. So for this, the landmark, Matthew, may I tuck up look at your belly button for a second? We're using the umbilicus. Now the section of umbilicus we want is the distal umbilicus. So I'm going to put my 0 point right on the distal umbilicus, and I'm going to the exact same location as the distal medial malleolus, and now we have a measure of 93.5. 93.5. Okay? Make sure when you're measuring, you're looking at that last round number, 10th number, 90, because sometimes people think it's 80, and that's how they get messed up. So make sure you see that number just before it, and you're actually going to the 10th of, so see how there's a longer line at the 5 mark. So the 0.5 is always a longer line. So if you start going above that, you know it's 6, 7, 8, 9, 10. So in case you haven't looked at one of these. Okay, so that is the apparent or functional leg length. The next one on your list is the femur or thigh. We must be within 1 centimeter of each other on this one. And we're using the ASIS again, but the the distal measure landmark here would be the joint space. So, and it says medial joint space of the knee. So the way I like to get the medial joint space, and there's different ways. I'm going to flex his knee a little bit. I'm going to feel the epicondyles. As I run off, it dips in, and I can actually feel the joint space. So on my, the inner portion here on the medial side, I can feel the joint space, that little dip, and I feel the tibial plateau distal, and I feel the femur proximal. That's one way. The other way I know in kinesiology that you're taught is to feel that patellar tendon proximal to the tibial tuberosity, and you're feeling the joint space right in here. I can feel the tibial plateau, and then I'm just coming around laterally and feeling for the joint space. So it doesn't matter how you get it, just be on that medial joint space. If you want to mark it, you can mark it. So I'm going to mark it. Okay, so again, we're going to the ASIS, and I'm going to do that distal ASIS, put my 0 point on, and go all the way to my marking of my medial joint space, and that would be 49.1. Okay. Oh, sorry, took my hand off. All right, so that was 49.1 for the femur. Okay, so now we're gonna go to the tibia and fibula, so the lower leg. So again, we're going to use that medial joint space. So a lot of these landmarks are the same, less to remember. So I already have it marked, and I'm going to the distal aspect of the medial malleolus once again. So I'm putting my 0 point on my joint space, going to the distal medial malleolus, and that is 35.7. 35.7. See that? Okay. And the last one is the foot. So Matthew already has his feet uncovered, and I'm going to ask him now to sit in the chair. So the way we do this is to use a piece of paper. So, how you doing, Matthew?
Good.
Okay, I need you to sit up and come sit in this chair over here. Always take care of your patient. He was pretty quick. So he popped up. Now in the lab and in clinic, obviously I'm in a carpeted floor. It's my own house, so I'm not real worried about any germs, virus, bacteria, otherwise, or COVID. So we usually ask you guys to put a towel on the floor because we're in lab, we're in a public space with a lot of people walking around. And have the towel there for the patients who get on their, get on the floor with their bare feet without touching the carpet, okay? Or the flooring, actually. I'll move it this way. All right, so using a piece of paper, measuring down. If it's the right foot I want, I'm gonna ask Matthew to put his foot directly on the paper, okay? And basically I'm gonna mark the calcaneus. Can you see this? I'm gonna go straight down and mark on the paper. I know obviously it bulges out, so I'm trying to not follow in, but I'm going straight down to make my mark. See how my pen is straight down? Sorry, pinched a little bit. And then I'm gonna find his longest toe. And some people, of course, it's the second or third digit, but his is the first. So I'm gonna mark right here. And then I'm gonna ask him to take his foot off the paper, and I'm gonna reach for my, thank you. Okay. And I know this is his right foot, so I would, maybe you wanna mark it just to make sure. If you're doing the left and the right, mark the paper. And I'm basically just going to put my 0, and it's 26.6, I would say. So his foot is 26.6 centimeters. And that is the lower extremity.